Experts say it's important to use at-home rapid tests correctly, but some people on social media are tweaking the way they're using them. They're swabbing their throats instead of their nose. Local doctors say, and the FDA say, that's a bad idea. Sarah Hammond tells us why.
Almost 2 years into the pandemic, PCR and antigen rapid COVID-19 tests have become the norm. Now, as President Biden's administration plans to send out 1 billion at-home rapid tests, some are wondering how well they can detect the Omicron variant.
And unfortunately, the sensitivity of those are lower.
Because of that, along with early studies suggesting saliva may be a better way to detect the Omicron variant, the hashtag swab your throat gained traction on social media.
So there's been a lot of conversation on all types of sites that says, well, maybe if we swab your throat, then we'll get more virus and the test will do better.
Some people began to swab their throats instead of their nose with the at-home rapid test kits. And Dr. Jordan Asher, Executive Vice President with Sentara Healthcare, says that's a bad idea for a number of reasons.
There's different issues in the back of your throat that you don't want to be poking something hard in.
He says not only is it not safe, but it's also extremely difficult to do it accurately on yourself.
You'll get the back of your tongue because of the gag reflex. You'll choke.
The FDA has also put out a warning to follow the instructions with your at-home rapid test and only swab your nose. Dr. Asher says it's not out of the question that health professionals may start performing throat swabs, but for now, use the tests how they were designed to be used.
This is how we test for a strep throat, so we might get to the point of doing some throat swabs, but definitely not for the home kits.
And the FDA said on Twitter they don't have any data yet to suggest throat swabs are an accurate method for those at-home tests. So they say right now, just follow the instructions. For 13 News Now, I'm Sarah Hammond.
Health officials still say the best times to get tested are 48 hours after exposure or if you have already had symptoms. Otherwise, you run the risk of a false negative.